Are you ready? Okay. Okay, so the webinar objective today is to share strategies and resources for developing suicide prevention programs in American Indian and Alaska Native communities. The outline, here's part of the outline, is going through their suicide in Native communities, cultural continuity as a protective factor, breaking the silence around suicide conversation, some myths about suicide, responses to suicide, risk and protective factors, and of course, suicide prevention resources. Okay, so we come across here suicide in Native communities. Well, just as suicide rates vary greatly by country, state, and region, they also vary between and within race and ethnic groups. While some American Indian and Alaska Natives communities have experienced suicide rates as much as 10 times the national rate, other rates have actually been lower than national rate. Okay, so here barriers to suicide conversation. This is can be a difficult topic for different tribes because anything has to do with like death or suicide, things like that. Um, and some of the tribes, they're kind of not allowed to talk about that because they feel that it will actually create that to happen. But in other tribes too, you got different belief systems that um, that suicide is actually forbidden in their traditional culture to take one's own life. Sometimes these different tribes may believe that the spirit remains in that state or upon the earth and won't move on. Um, there are some other cultures where it's accepted. Some believe that suicide is an honorable behavior. So this can be a little bit difficult, a little bit challenging to different communities you might visit across the country. So that's one of the very first things is try to find out about is how their belief systems may be affecting this, or if they want to even bring it up or talk about it. One,
These barriers that Sean's identified or discussed are significant in our review of what is occurring.
okay, some myths about suicide. Again, this is part of something you need to find out within the tribe because it may not be acceptable. But this part is talking about suicide, especially with adolescents. Um, They believe that it'll plant the idea within their heads that may lead them to suicide. Only the experts can prevent suicide. Actually, it's the task of the whole community, and that's the way that we try to work with. Is try to find other people within the community, the tribal community, who will take this seriously. Different groups who may come together in order to develop plans of prevention. Might be cultural people, traditional leaders, um, is of course like psychiatrists, doctors, social workers, behavioral health workers, elders, maybe even to talk about teachings or to work with them around the culture and start to teach them more. Okay, so myth three is about suicide. Individuals who are considering suicide keep their plans to themselves, and the secrecy makes prevention impossible. Truth: individuals considering suicide frequently give verbal, behavioral, and situational clues or warning signs before they engage in suicidal behavior. Um, this is something to look at. And, sometimes you have to look at behavioral changes, the way they're maybe moving, different things they might be doing. Look for those changes. But also, when people have been talking about suicide and having these ideations, if all of a sudden that ceases and they begin to be happy, that can also be a warning sign because it's a big change from what you've seen previously. And they may believe that they see an end to that suffering, an end to what has been bothering them. That's if they say anything like that, that's definitely something to be alarmed about.
I might interject here that many of the suicide prevention programs that are out there, mental health, first aid, and number, really good tools that are available across the country. Really take a close look at addressing this myth that individuals with considering suicide keep plans. These prevention approaches that are out there sensitize community members, providers, family members around social issues. So they could be sensitive to some of the other individuals, family members, community members, who are contemplating taking their life. That's a value that I wanted to mention as we look at the prevention models that are going on and being applied in different parts of leadership. Great models to follow and great tools and toolbox as we
What did you do? Like just get closer to the phone or speak up?
suicide prevention leadership.
Ray, I'm so sorry. We're having some trouble hearing you yet. It sounds like you might be covering up your microphone or something, or you might need to get it closer to you or something.
Can you hear me better?
It's still pretty muffled.
I don't know what that is. I got everything set. So,
If you have the do you see the microphone icon on your screen? Yep, and you should be able to do a drop down next to it, and you may be able to adjust the volume. Is that there?
Is that better?
Yeah, that is better.
Okay. So the quick reiteration I was pointing out earlier that we have a very good set of tools available to us in Native country that are that really work at having providers and community members and family members be sensitive towards identifying when we have a family member or community member who is considering suicide. Tools like mental health first aid, for example, are out there. And I think we have, because we have access to these tools, makes us uh, better, more capable at dealing with the third myth that was talked about earlier.
Yeah, a lot of times what you might want to consider also is that whenever you're out in the whenever you're out anywhere in public, is to make it a habit or practice to reach out to people, to speak to them very nicely, ask how they're doing. Um, that's what I have in my life whenever I go out to public area stores or anything like that, because I see people, they seem to be scared of me. Maybe based on my appearance, sometimes maybe my long hair or the color of my skin, I'm not sure, but I usually speak to them and I try to make them feel safe. But one time I did this, I had gone through the store and everything, and much later she caught me at the checkout. She said she really wanted me to know how I made a change in her life and how that I made her feel happier than she's ever done before, and she wanted to do something different. And even what I instantly had a feeling was that I thought what she was talking about is possibly harming herself. But I immediately began to talk to her nice again and said, well, it's no problem. It's a really good day, all these kind of things like that. But what you need to also remember is that no matter who you come across, you never know who it is, because they definitely don't walk around with a sign on themselves that this is what they're thinking. So that's something I try to take in mind wherever I go. Okay, here is also risk factors for suicide. Some, of course, is historical trauma. I think you've seen some of these cases now where epigenetic memory has been known to pass through 14 consecutive generations. Look at family history of mental illness or substance abuse, cultural distress. Also, this is, if you're looking at even within tribes, there may be people, maybe they're mixed blood, maybe sometimes they may not look like a native, may not have the same kind of background as many of the natives within the tribe, but they may also kind of get some discrimination upon themselves within the tribes themselves. So it's kind of, and then it turns up to lateral oppression. So that's something to take in consideration. Negative boarding school, chronic illness.
Um,
But
Go ahead.
talking about protective influences of culture and community, a general discussion of suicide risk and protective factors is in order. Briefly, risk factors are associated with a greater potential for suicide and suicidal behaviors. Protective factors are associated with reducing that potential. It may be helpful to think of these factors in terms of how they may hinder or help a person as he or she travels their life path. can be very complex. There's no single reason, a cause, or emotional state that directly leads to suicide. There's been much research on this about including behaviors, risk factors, trigger events. But within the Native American culture, American Indian Alaska Native communities, it's comparatively limited. Certain risk factors are common among American Indian Alaska Native youth. These factors are not part of being American Indian Native or Alaska Native or the culture itself, but those factors are poverty, depression, those kind of things that may affect American Indian Alaska Native communities disproportionately. So remember, if you're looking at risk factors of suicide behavior, it's best understood and addressed within the context of the culture and community. So it's very important to be able to get within the community and find out what the culture is and what they believe and the things that might be helpful to them. But with many things, you're really looking at the culture as being very protective. Okay, here's some risk factors. Poverty, of course, unemployment, geographic isolation, and other environmental factors. But looking at this, poverty, isolation, mental health, and substance abuse are also risk factors for abuse. Hopelessness has a profound effect on people. There are cases where some children, much early, they've been locked away or in a closet or in a attic or something like that, but they had lack of growth. They didn't grow the same way as other people. Maybe they were very small. It's like they've lost the will to even live or to thrive in life. So remember, there's so many different things about trauma or stress that has much more effect on people than what they always think about. Okay, here's some protective factors for suicide. You're looking at cultural connectedness, cultural and spiritual beliefs and teachings that discourage suicide and support self-preservation instincts. Effective and proportionate or appropriate clinical care, of course, making sure that you're able to add the culture in there and remember that the people or the culture you're working with. Easy to access a variety of clinical interventions and support for seeking help. Remember, the community is all around you. There's many people who can help, the elders, healers, medicine people, maybe there's people, leaders of certain ceremonies or the leadership within the community, something. Ray, is there anything you? Oh, Ray, is there anything you'd like to add to this?
Yes, strategies to really take on uh, protective factors include, I think, looking at creating systems that do include peers. Uh, Most of our suicide deaths do appear to be uh, within the age groups of 16 to 28, which means that a peer system would have to be younger, primarily male in most cases, so that we can have stronger efforts at preventing suicide attempts and suicide deaths in Native country. Um, and so I realize that in some Native communities there's a movement towards having peer support systems more strongly engaged and looking for resources to be able to do that. Because it is cultural connectedness and cultural and spiritual beliefs that are really sort of significant protective factors. Thank you. Thank you.
Okay, so again, with protective factors for suicide, um, restricting them access to highly lethal methods of suicide, family, community support, support from ongoing medical and mental health care relationships, learning skills or problem solving, conflict resolution, nonviolent handling of disputes. Um, if you're looking also within the culture, um, the relationships that they have with their families can be very important. The relationships within the community is very important because those are the people that you usually work with. And if there is any kind of substance abuse that happens, normally spirituality is the very first thing to go. So that's one of the reasons when they begin to help people, they really bring in spirituality. Because what happens then is many natives are they're taught, they're believed when you're using anything, you cannot go to these kind of ceremonies. You cannot be in these kind of places. So what happens is they kind of back out of there. But then people from those communities or the ceremonies, whatever it might be, they're saying, "Where have you been? I haven't seen you for a while." So after a while, then they begin to even back away from them in the community because they don't want to be seen in the community. So then that's their family. Their family begins to say things. So what happens then is then they go back and they're kind of isolating themselves. That's also kind of something to look at as a risk factor. But remember that protective factor is a family and community. Ray, is there anything like to add with this?
I think your points are really well taken, Sean, and I think the participants on the webinar can relate to how these protective factors are critical. There are beginning to be in the field strongly encouraging methods and models for integration of medical and mental health services uh, because those end up being really key towards being able to identify what is going on with suicide attempts and deaths in the community, particularly when they're occurring in clusters or there might be contagion involved. Uh, and so that relationship between medical providers and mental health providers ends up being really crucial because the medical providers are the ones that end up doing primary care services to and for individuals who hurt themselves or take their lives. So they're the first line around providing those services. On the mental health side, we need that information on how attempts and deaths are occurring and demographics related to that so that we can better develop our interventions and our prevention practices in the native villages. So it's key to have that support and really strong coordination between the two disciplines. Because then it rolls on to sharing that work and the progress that comes from it with the community and the leadership and families. And unless we do strong work at identifying methods of suicide, then we end up not being appropriate in our interventions, especially. There are some portion of deaths that are by by guns, and there might be some portion of deaths by hanging or rope, and some portion of attempts, for example, that might be ingestion of drugs and other substances. And those are important things to know in terms of creating a prevention system that's more relevant to the problem that's developing, and and being able to do all of this in a healthy way so that there aren't disputes among providers in the community, whether they be from primary care or mental health and the community.
Okay, cultural continuity as a protective factor. So when we kind of think about this, is that look at the children within a tribe, the culture. Nurturing the children is, a very basic aspect of American Indian Alaska Native culture, protecting those children from harm. Because what happens is you're looking at your children to nurture them, help them grow, to rear them. Because what happened then, you're extending those roles within the family, the clans, the tribe, because they are our future. They're the future generations. Over time, with what has happened in the past through placing natives away from their tribe original lands and placing them on boarding or on reservations, boarding schools, imposing other kind of culture upon them. Um, of course, giving them alcohol. Their traditional values and things have kind of been changed a little bit, but also the traditional family values have survived. There are different tribes, different families that can be very traditional, but there's also those who might not be a traditional. The way they see things might be different. I mean, when I was younger too, it's like um, parents didn't spank children. Just didn't do that, and it's kind of neat how later on that practice became kind of nationally is no spanking. But looking at also some research with the University of British Columbia, they found a distinct positive relationship between some of the particular aspects of what they refer to as cultural continuity and reduction of suicide and suicidal behavior among Native American youth. Um, it was based on studies of the First Nations communities. Of course, First Nations are from Canada. That's just how they refer themselves. Instead of like American Indians, Alaska Natives, they consider them First Nations. Um, but the culture was a very strong protective factor of those people, because what happens is teaching them the culture, a secure sense of the past, their present, their future, of their culture. They knew who they were. They felt they were needed. They felt they were part of something bigger than themselves. Ray, you have anything to add?
You covered this topic really well, and I think most of the participants in this webinar can appreciate how culture is a significant protective factor, and it's been interesting and really pleasing to see how most tribes and most Native organizations and programs are really enhancing cultural services, including the use of indigenous foods also. You know, we tend to think of culture as dancing and drumming and singing primarily, but culture also includes how we dress and how we conduct ourselves privately and publicly, but also includes the way that our ancestors have nourished their bodies historically, and so there's been a strong movement towards including food as, as part of the culture and identifying what we eat as a strong protective factor also.
Okay, so next is responding to suicide. Um, to look at this, responding to suicide deals specifically with actions that a community might take, you know, after a suicide occurs. Young people appear to be particularly susceptible to suicide behavior when exposed to suicide death of other people, especially those within the community. Now, if you're looking at native communities, what happens is it's not just a big town with everybody is very different, all these different cultures, all these different family members and ethnicities and everything. But within the tribal community, about everybody always knows each other. They build relationships and things like that. They know their cousins, who these people are. Um, you see them like maybe you don't always talk to them, but maybe they're part of the ceremonies that were going on, some of these kind of events that were happening. So these kind of things you need, you know, take into consideration. Also, with this is looking at the tribe holistically, looking at each individual holistically. Um, one thing they talk about is like the medicine wheel with work with tribes, or the sacred circle, or the four directions, or 6 or 7 directions. So looking at that also, so many people say, well, you have the body, you have emotions, you have the physical mind, and also the spirituality. What happens many times is because of whatever's happened in the past and how this has affected people, they have not always been taught about how to deal with different emotions, how to deal with difficult emotions. If you think to yourself, and I do that at times, it's like I have a show of hands. It's like, let me hear, let me see. It's like, let me show of hands, everybody in the crowd here, of who has been taught how to deal with difficult emotions by your parents or your grandparents. Because normally what happens usually is that not many people raise their hands. Sometimes nobody does. So it leads you on. It's like to see, it's like everybody's going through the same thing. We're not being taught those things. How to deal with that. Usually a child might come to their parent, Mom, Dad, this is happening at school or whatever's going on. And usually the parent will go, oh, it'll go away. It'll get better. Just ignore it. Or tell the teacher, something like that. But those things need to be kind of nurtured too. It's like how to think about it differently. What does it mean to just ignore it? I mean, of course, you can't just ignore when somebody pushes you or hits you. You can't always tell a teacher. You can't always do these things. There's so much more in dealing with emotions and thoughts and feelings. It's like also developing prevention plans for yourself. How you're gonna act in certain things. What are these people doing to be able to get a certain response out of this person? Because many times if you're looking at even with bullying, sometimes those responses that the bullied person is giving may lead it to keep going on. So in a sense, changing the way they see it makes it so it's not even fun for them anymore. People who make fun of people who cry. It's like if the person doesn't cry anymore, it's not fun for them to make sense or to make fun of them if they're not going to make them cry. That's something in a sense that I went through when I was young. There are some of us in the tribes, it's like we can be very sensitive, but at the same time, we have our strengths. But emotionally, it's like you can be very sensitive. But what happened is then when I was 9 years old, I kind of prayed. I said, I don't want to cry anymore. I prayed that way. I didn't cry again until I was 17 years old. Not one tear. And I'd had grandparents who passed away. I had a sister who passed away. Loved ones who passed away, and I could not cry. And when I was 17, it bothered me that I could not even cry when my sister passed away, my own sister. So I began to pray again. And then I remembered, oh yeah, I prayed about this. I, I prayed again. That was a mistake. I want to cry. I need to let that pain out. Because within many different, within native cultures, crying is healing. Whenever water comes out of your body, that's healing. Just like in a sweat lodge. That lets out those emotions, it lets out that pain, lets out those hard feelings and the things that, so you're not carrying them, because that's excess baggage. So you need to be able to let that out. And many times it's like working with youth. I said, how many of your dads have taught you it's weak to cry? Most of them raise their hands. I said, well, how many of you have accidentally caught your dad crying? Everybody bowed their head because they didn't want to say, but at the same time they were scared. I said, so how's that feel? I said, I was scared. I didn't want to catch my, I didn't want to catch my dad doing this. Very slowly backing away in hopes that the dad didn't see you. And that's when I began to look at crying and remember the teachings of crying, how it's also healing. And I began to see how women cry. Some of these women cry all together. You don't see tribal women, it's like they're all bunched up together, crying together and helping each other. You see men, you don't see a bunch of men holding each other and crying. Normally, we see men crying off on their own, alone, where nobody else will see them. So I began to look at that. It's like, what is stronger? I believe it's stronger to be able to cry in public than it is to go off somewhere else and cry alone. That's when I began to see the strength of this and really began to see the truth in how this is healing. Bray, do you have anything to say?
Yeah, I think you're right on target again, Sean, with your comments, and I want to point out a couple of things. Unfortunately, one of the responses to suicide deaths um, in some parts of the world and this country and Native communities is memorializing of a person who has taken their life. And that memorializing of someone who's taken their life is not a effective response to suicide. And it's important, I think, to talk with young people, especially because they tend to want to do memorializing, and families that want to do that to avoid or do low key memorializing among themselves or in the community, so that it doesn't get get all over the community that someone has taken their life, and that and because that can trigger contagion and can result in clusters. So the responding to suicide, I think, from a prevention side perspective, is being conscious of and being alert to issues that come out of memorializing. The second thing I want to point out is that in the suicide response um, and how we as providers respond to a suicide death in particular, it is really significant. Uh, Providers do get emotionally affected when the suicide deaths occur in our community, especially the smaller Native communities, because we know everyone, even though we may not be from that Native community or born to that Native community, our presence in those Native communities naturally results in us knowing quite a few of the families that are there. And when a death happens, it does affect us emotionally. That means from then that it's valuable to have good clinical supervision available to providers so that if a death does happen in the community, especially a suicide death, that we as supervisors and managers and fellow clinicians and providers can be able to be sensitive to that and be able to respond to each other's pain and each other's anger, which is a regular response to a suicide death. And and also related to this is that we have individuals in our communities who respond to these suicide deaths and the suicide attempts. ER, urgent care are among the first responders when an attempt occurs, and they see the physical effect and mental effect on the patients who have attempted suicide and how that affects family members. And when a death occurs, then you're looking at a broader set of responders, which is primarily law enforcement, uh, um, and first responders that include medical providers on the field. More Native communities are including behavioral health responders to deaths that happen or even attempts that happen, which means that our Native or community responders to deaths and attempts are also adversely affected by what they encountered and what they experience out there. So it's valuable to have a safety net for everyone so that providers can process the pain they feel and sometimes the confusion they have around how and why a death or an attempt may have occurred in the community, because that leads to health problems down the line and emotional problems down the line that affect the quality of care in the long run. So I wanted to point out that how we respond to suicide does include our responses to providers and responders when a death or a serious attempt occurs.
Why don't you go ahead and lead the rest of these, Ray? I think you have a pretty large background information on this and what you've done in the past.
Okay, I'll work on the suicide prevention strategies that work in Indian country are there are an array of strategies that are in design or in effect. And a key point to make from this, for me in particular, is that those strategies are dependent on each individual Native community. Uh, there is not one particular strategy that can be applied across the board to Native country because we have such diverse populations. We have some reservations, for example, there may be two tribes on a reservation. Well, each tribe on that reservation of two tribes has its own culture, has its own ways of being that are important to be able to recognize. So it gets complicated when looking at prevention strategies in Indian country. You have tribe A that is and tribe B who might be historically might have an historical history of being in conflict with each other, and that happens quite often in some reservations where you have tribes that are put on the same land that have a history of conflict. And so how we develop strategies in a community like that is really sensitive and important to look at. So it's strongly recommended that we look at the healthy environments that do exist for healthy and empowered families. The suicide attempts and deaths that occur are not a large portion of a Native population. Most Native families are doing well and quite healthy. And so from those families in a native community that are healthy and healthier, then we can work at empowering them to be able to help in the responses, either as individuals or families or in a broader community. This goes back to my comment earlier about creating peer systems that are supportive for the young people as they migrate through life stages. I don't think it's not surprising that young natives are the ones who are more likely to take their lives, the ones from 16 to 28, because they're the ones who are making transition from a number of major transitions in their young lives, from 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 teenhood to adulthood, and then from an educational system to being more independent in a broader community. And those are transitions that are difficult for any young person to navigate through alone and by themselves, particularly when those native youth are not having access to them, peer systems that they had developed in high school. So that's important to do. I'm seeing a note that I'm not coming in that clear, so Sean, you might want to pick this back up.
Okay, so here we have again suicide prevention strategies that work in Indian country. If you're looking at promoting protective environments, reducing harm, and prevent reattempts, of course, engaging community stakeholders for prevention in initiatives, teaching coping, resilience, and problem solving skills, improving suicide prevention, data collection, research, and evaluation. But also looking at these promising strategies involved the adoption of mental health focus on risk and protective factors across the lifespan. Also, the adaptation of public health based interventions that promote opportunities for youth to gain self esteem and avoid substance abuse or risky behavior. All this while also incorporating traditional tribal responses as effective prevention strategies. Developing programs and initiatives um, that you have to ask all these questions. What are the strengths does the community have that will help them cope with and overcome their problems? How can the elders help community members overcome past traumas and maintain their cultural identity? And how or in what traditional ways were the community's children taught coping and problem solving skills? How can community members help others to feel good about themselves and build resilience? How are some of the old stories that affect the youth deal with change? There's so many different stories and creation stories, traditional stories that help to guide life and guide people in different kind of actions. Um, but also look at what can be said to young people to give them greater hope in themselves in the future. Um, a lot of times I think that looking at some of the stories that we do, it's kind of changed a little bit over time, because I remember going to elders before. They never gave me an answer all the time. They always just told me another story. Uh, After a while, it gets like, why keep telling me stories? But you have to be able to work at these things, because sometimes what happens is it teaches you to get to the right answer. It's teaching you how to think differently, how to approach certain kind of instances in your life, but to also hoping and helping you reach the right conclusion to this. Because within this story, it has the clues to it, has actions, beliefs, and all these kind of things, and what happens. So I began to look at these a lot better, and maybe take me a while to keep thinking about the story over and over and over again, maybe days, weeks. And finally, you find the answer. You go back to them and says, was this the answer? They say, yes, that's correct. Because part of finding answers sometimes is also a journey. Some of them believe that if they just give you the answer, in a way, they're stunting your growth or stealing, in a sense, that chance for you to grow even further. Of course, the elders and the community members can really help. Maybe looking at what they went through, looking at how they maintain their cultural identities, even with their past trauma, what they went through in the boarding school, how look at children from the past, how they deal with things, how did they learn things? Because sometimes when I look at the youth from the past when I was young, for some reason we seemed a little more mature than the children that we see today. So also looking at this is prevention interventions to promote cultural connectedness, talking circles, sweat lodges, ceremonies, purification, rites of passage, reintegration into the community, reconciliation, meditation, storytelling. Some of this might also include somebody who needs uh, a ceremony or a native name, like a spirit name or Indian name, whatever it might be, because within this name, there's also, in a sense, a power to it, a way that drives you toward reaching what you're supposed to learn here. It's like different names, they mean certain things, and that's exactly many times how this person actually is. It's like my name was had to do with a bear, and it's always searching for answers, always searching. So, of course, growing up, I was always asking a lot of questions. A lot of the elders would say, "You're not supposed to ask elders that." It's like, "Hello, can you hear me?" Okay. Okay, of course, like the sweat lodges, it may be a little bit different from tribe to tribe, because some sweat lodges within tribes, they may not have mixed women and men. They may do them separately. So you have to be able to look at that. Ceremonies. Sometimes if you go to a tribe and they ask you to join in with this ceremony, especially if you're from another culture, I mean, that's a good time to take that chance in trying it, because sometimes if you don't, it may also look like you don't respect their ways. But purification ceremonies could be the sweat lodge, or like a healing rite of passage, either from a young woman to womanhood, a young boy to manhood. Um, those are kind of a little bit, normally a little bit younger than what we see today, because many times they say when they're 18, they're an adult, or when they're 21, they're an adult. But it might be a little bit different, because before it's like when a boy reached 13, they're an adult. When a young girl started her monthly time, she was an adult. Might be reintegration into the community. Look at if they've been gone a while, or maybe they're trying to get back in the community. They might have some difficulty but help them to get back in the community. Find those people that help them. Reconciliation, of course, meditation. Um, might be part of going on a fast. If your tribe's fast, not all tribes have fasting, but a lot of them do. That might be part of that meditation. Here are some of the resources which much of this information came from. Also, cultural information. Of course, that's not always going to be able to come from books. But we'd like to thank you. Is there any questions at this time? I'll leave this up. But I'll leave this here up, the resources, in case you want to copy it down. There's questions.
Hey, can you hear me now? Oh, I'm getting an echo now. My apologies, I was having an audio issue there too after we had a little connection issue here. But I wanted to give Ray a chance to say any final thoughts before we close out.
Okay, I wanted to thank everyone for joining us, and I also would like to mention that the Native American Alaska Native Technical Assistance Center that Sean and Megan and Katie and I are affiliated with, we do provide technical assistance and training opportunity to Native country around this topic and a whole range of topics also that we can make ourselves available for. So if you have any questions on what that technical assistance and training, those opportunities might be, of course, let Sean and the others on the team know so that we can forge a good response to everyone. So thank you.
Yes, thanks so much for mentioning that, Ray. We have provided technical assistance in a number of areas where there have been issues of suicide especially. So please reach out if you wanted to put together a team that could have, we've done this before where we've had monthly calls, so we would be happy to provide that service. I don't see any other questions at the moment. But please feel free to email us if you have any more questions on this topic. We'd love to hear from you. And yeah, I just want to thank everyone again for joining us. And I want to make sure that you all know we are recording this session, and we will send a link out to everyone who attended with the for the recording, so you can view it again. You can share it with others. It'll also have the handouts attached and a CEU request form if you'd like to use that. And so let me see. Having some issue with the links. Okay. All right, well, we will check into that, and I will see if we can update those for the handouts that we'll be sending out. And let's see. I don't see any other questions now then. Sean, did you have any final thoughts you wanted to share before we finish up?
No, not really, no.
Okay, thanks so much. And yeah, with that, I guess we'll finish up for today. And I just want to thank everyone for joining us and for putting up with our audio issues. My apologies that we were having some issues hearing everybody evenly. So thanks for your patience with that, and we hope that you're able to get something out of the session today. So thanks again, and we hope to see you next time.
Thank you all.